Hi, I'm Linda, creator of information about arthritis. If you are new to this channel, then don't forget to subscribe. Just click the subscribe button below and then click the notification bell to receive notifications of new videos when they are released. Also, don't forget to visit my website, Food with Arthritis, where you can find out more about these terrible diseases and download free articles. In this video, I shall talk about polyarthritis, what it is, how to cope with it, and a lot more. So, let's get going. There is another name for polyarthritis, called polyarticular arthritis or inflammatory polyarthritis. It affects more than one joint and is related to autoimmune diseases, such as rheumatoid arthritis or RA. It could start with a particular viral infection. There are two types of polyarthritis rheumatica. The first one is seropositive. Seropositive means that you have antibodies in your blood that attack your body instead of attacking the bacteria or virus. And the second one is seronegative. This second one is where particular antibodies don't exist in the blood. It can be caused by catching rubella or mumps, as these are also caused by triggering the immune system. Therefore, harder for the doctor to diagnose. It has been seen that this disorder rarely affects people under 50 years old, but can attack those 65 and over. Polymyalgia rheumatica. Unfortunately, with polymyalgia rheumatica, you could also get something called giant cell arteritis. These attack the lining of the arteries, which is mainly in the temple, and if gone untreated, it could lead to stroke or blindness. The risk factor of polymyalgia rheumatica is that it mainly affects people between 70 and 80 years old. About 2 to 3 times more women than men develop this horrible disease. It's common in white people that have ancestors from Scandinavia or Northern Europe. Causes of polyarthritis. This attacks your healthy immune system and mistakes its own cells and tissues. Researchers have not understood the autoimmune disease, but have found that it's related to the environment we live in or genetics. Polyarthritis also occurs as part of another illness, for example, rheumatic fever, viral infection, hepatitis is just a few. These could be temporary and move between many joints. In some cases, children can develop this disease called juvenile idiopathic arthritis or JIA. Researchers have found nothing why children get this, only that it's a genetic factor. They have found that some people could have antibodies that are naturally destroying the protein in the body, which makes the disorder flourish. Or when the body has an infection that weakens the immune system. There are many causes of polyarthritis, such as cancer, Still's disease, lupus, gout, and much more. Symptoms of polyarthritis. The first symptom could be a flu-like illness. Then inflamed joints occur followed by swelling of the joints. Feeling warm, you may have a slight fever. Painful and stiffness, especially in the shoulders, neck, hips or thighs. Movement is less, you may have less motion that may stop you from washing or even regular household duties. Also, climbing the stairs or getting out of bed is a struggle and will need help. When you wake up, you could be stiff and painful. But this gets better when you get mobile. Lack of appetite, you may feel that you cannot eat. Or a sudden unexplained weight loss. A rash will appear over your body, and you will feel sweaty. The temperature may be 100 degrees or over. Fatigue, you may feel tired all the time and lack energy. Also, feeling anxious and depressed. Polyarthritis in children. The second common type of juvenile idiopathic arthritis could last into adulthood. For the first 6 months, your child could experience pain in 5 or more joints. Polyarticular has 2 types called polyarticular RF. One is positive and the other negative. Polyarticular RF positive arthritis. Positive arthritis is common with children over 10 years old. It has an asymmetric connection with more than one joint affected. It's common in girls than boys. But the good news is it's at low risk of eye disease. Symptoms. It would help if you looked out for the following symptoms in your child. Your child may have hard bumps under the skin called rheumatoid nodules. This can affect both small and large joints, and on both sides of the body. similar to the adult's rheumatoid arthritis. Low appetite and unexplained weight loss. Fatigue, feeling tired all the time and don't want to play. A general feeling of unwellness. Polyarticular RF negative arthritis. Negative arthritis can start at any age, and again it's more common in girls than boys. It also begins with many joints affected at the same time. This one can start at any age, with 20% of children with juvenile idiopathic arthritis. Symptoms. Sometimes it starts with 1 or 2 joints. Then it spreads during the first 6 months. And could last into adulthood. Children with juvenile idiopathic arthritis could develop damage to their joints. Therefore, mobility will be difficult. And can even have problems with growth. When to see the doctor? The doctor will start by finding the cause of the reason for the joints being painful. Inflamed. Tender. Swelling joints. Also, they will test how you can move your joints if there are any rash, skin nodules, sore throat, or your lymph nodes are swollen. They will then assess your pain to see if it's occurring on both sides of the body, which is called symmetric, or if it's symptomatic, on one side of your body only. The doctor will also see if you are anemic. This shows a lack of red blood cells, as these blood cells carry oxygen around the body. Depending on the doctor's result, they may take you to get an X-ray or MRI scan. This will show the cause of the pain. And finally, if you are over 50, your doctor will probably diagnose polymyalgia rheumatica and start treatment immediately. Treatment of polyarthritis. The treatment for this is the same as autoimmune disease. Anti-inflammatory drugs will reduce pain and stiffness, like ibuprofen cream or pills. Modifying anti-rheumatic drugs which help to slow the disease. Or corticosteroids. These are steroid injections into the vein, which lowers the inflammation. Home remedies. The first one is warm or cold therapy. This could be a warm bath. Wearing warm gloves, especially in the autumn and winter. Or you could get some heat pads, which I have in the nighttime on my back, to relieve the pain in my spine. The second is that you need to exercise. Doing gentle activities like swimming. Walking, even stretching can help with stiffness and pain. Proper diet. You may need to lose weight because if you are overweight, you will be putting more pressure on your joints. Over-the-counter drugs, if possible, you should not get any over-the-counter drugs as this may be bad for you. Instead, you should only take your prescribed medication from the doctor. Conclusion. Polyarthritis is an arthritic disease that can attack adults and children. It attacks the healthy immune system, therefore, it's like the adult's rheumatoid arthritis, which can be disabling for you, and can have a significant effect on your health and lifestyle. However, early diagnosis and treatment can reduce the disability and pain, therefore a better lifestyle. Overall, when you get polyarthritis, and it's detected early, and you take proper action, and you have a healthcare team that can help you through the bad days, then you could have a healthy, long life. I hope this video has helped, and don't forget to subscribe to my channel and receive notifications when new videos are released.